Okay, this is saying that we're getting live here. Brad, you wake up? Wake up! Oh. Okay, folks, come on in. Don't be shy. Come on in. Join the fun.
I think they're doing fine, Bob. They're
Okay.
not, look at them. They're coming by the thousands.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We're one of the most famous physical therapists on the internet.
In Alpena, of course.
Today, Brad, we're going to talk about 20 easy Swiss ball exercises for core strengthening, back pain. We're also going to show you a couple new shoulder and leg exercises.
Right.
We're covering it all.
Right. You're really going to learn the beauty of the ball.
Right.
Say no more.
He loves that phrase, by the way.
Yeah.
If you are new to our channel, by the way, please take a second to subscribe to us on YouTube. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, if you haven't already, go over to Facebook and like us. I know we're doing Facebook Live. Hello. But we're at Bob and Brad on Facebook. And you're really going to want to join us today on Facebook because what are we doing, Brad?
We are giving away a wonderful product.
Yes, we are giving away a Thermatex
Far
infrared, I guess they call it a system or pad.
It's a heat pad. And it's working wonderful. Deep heat into the joints, into the muscles. 2.36 inches. That's 10 times deeper than you'll get with your conventional hot pack.
Exactly. You're going to notice a difference that this thing does a lot better job. This is the platinum model, and so you can use it on any part of the body basically. And what cool feature they've added now? They've added some straps that you can put on, and so the straps actually will strap it onto your back and work on your posture at the same time.
Right.
We don't have the straps here with us right now,
right,
because we plan ahead. But so you want to go? We have a post there on Facebook right now already. It's a picture of a lady with this on. You just have to like that post, and you're in the contest. That's all you have to do.
That's all she's got. Is that on?
No, she's got other stuff on. This is a family show,
okay.
Brad. What are you doing here?
Clarifying it.
So,
I want to make sure they know.
And by the way, if you don't win and you want to order one, we have the order information there. There's a code there. You want to use Famous PT because that'll get you some money off, and it'll also get you free shipping. So
say no more.
All right.
Say no more. Should we get on with the?
Let's get on with the show.
Number
Brad.
1 of 20. Okay, we're going to work on. A lot of people don't realize you can use this ball, and we're using not just a ball, we're using the Toga ball.
Yeah, I'm not sure how to pronounce it. It's TOGU. These guys have been making balls. They're a German company. They've been making inflatable balls like this for 60 years, I think.
60 years.
And this has got what they call anti-burst technology. I saw a video somewhere where they were driving a vehicle over this thing and it wasn't popping. I mean, this thing is solid.
Yeah, when you pick it up, it's clearly a step ahead of the majority of the balls.
This is a ball. If you're worried about the ball popping, you don't need to worry about it on this case here. So
all right. Shoulder, if you want to work on getting your shoulder to come up, you have frozen shoulder, you're working on a rotator cuff injury, watch Bob use this, and it really works well. I use this on almost all of my shoulder injuries to get the range of motion. But make sure you look up, Bob, at the camera. There you go. Posture. We help each other out all the time.
So what this does is that when I go way out like this, now if I were to stand up, look at a sneaky way of getting motion here.
Right.
Now if you want to, you can also do the mulligan technique with this, Brad. You can actually push down while you're doing this.
Right.
And push down while you're coming back.
Right. And so that can set that shoulder joint in where it needs to be to free up your range of motion.
Right. All right. Then we'll go to the next one. I'll do it on this arm now. We're going to go ahead and work abduction. So this is going out to the side. If let's say you're lacking some shoulder abduction, you're going to go ahead and you can do the same thing here. You can roll out like this, roll it all the way up to the armpit. And it's, again, a sneaky way of stretching the shoulder, and it's painless. You want to do it so that it is painless.
Right. Now, you can see Bob's 6.5 foot tall. Normally, he'd probably have a little bit bigger ball, but we're going to keep it to one ball. It'd be a little more
comfortable maybe. Yeah. No, it's fine.
Now, the next thing you can do is people don't aware of it. Oh, thanks, Bob. is you can do the same exercises on the wall. So I call them the ball on the wall exercise. This is for overhead. You can stretch it. Look at that. I mean, I'm as far as my shoulder is designed to go, and I can get that range of motion and stretch it. And you get some strengthening with this as well.
Okay. Boy, I should mention that the ones that I was doing, you can actually do that after having a stroke.
Sure.
And if you have a weakness in that arm, it works really well for that. We've used it for that before, and it's just excellent. So, and also, by the way, Brad, sorry to cut you off some more, but the way we run this show, by the way we run things is that we're going to go ahead and do the program, and then at the end of the program, we will be taking your questions, and we'll hopefully give you some answers.
Sure. I thought you were going to say we run it by the seat of our pants.
Yeah, we do run it by the seat of our pants too. That goes without saying.
So back to the exercises, Bob. We can get back to them now. Is we can go abduction out to the side, up the wall, just as well as flexion. Okay, and the next one, extension. In other words, going behind. Can you reach behind you, or is your shoulder?
Yeah, believe it or not, this is one that quite often is tight on people. And a lot of times, if you're having shoulder pain, if you work on this one in a pain-free range, it'll start to lessen your shoulder pain. It's an old McKenzie technique.
Right.
So you can actually just roll the ball back like this. Or you can actually step down like this.
Yeah. Yeah, just
Either
use
way.
the legs.
Yeah. Either way, I'm trying to increase the motion. I got my palm down.
Mm-hmm.
It wouldn't work the other way around.
Right.
So again, I'm going to work it this way. I'm working it way back. Or I'm going to go ahead and step down like this.
Yep. Good extension.
Good. In McKenzie, we talk about a lot of it, for the back pain, but he actually has some good stuff for the shoulders and knees too.
And now that you mentioned back pain, the title did say back pain, and this next series is going to specify strictly that. We need to get this out of the way.
Get this out of the way. We're going to do our housekeeping right now. By the way, somebody asked while you're doing that, Brad, they asked if this is a heating pad. It's really more than a heating pad, the infrared. It's infrared rays, right? And again, heating only penetrates only a few millimeters. This penetrates 60 millimeters or 2.36 inches, so it's much deeper.
Right, it's a different wavelength. That other ones are technically called convection heaters, the ones you can buy at the store for $20 or $30. This is much higher in the spectrum, the far infrared. Yeah. Good question. Okay, now for the back for the ball. This is one of the nice ways to get back extension. In other words, to bend your back backwards using gravity in a comfortable manner. And you're just going to lay on the ball, let your shoulders go back. Bob, you want to grab me a towel?
Sure.
And just let your shoulders relax. And now I'm arching my back over the ball in a really relaxed manner, allowing gravity to do the work.
Well, I don't have a towel. How about a sheet, Brad?
There's one over there, Bob.
Oh, okay.
There you go. Now, we've been busy here at the clinic, and the towels get used up. There you go. Just this one. Now, one thing you're going to find for some people, it's going to be uncomfortable on your neck. So take a towel and just go like this. Makes a big difference. And now I can do this very comfortably and relax and breathe.
If you're worried about your balance the first time, make sure somebody's with you if you try this. It's not as hard as it appears to get into this position, but it's a little scary the first time.
Yeah. So have a partner to help you out. This one is much easier. You just go on your knees, and this stretches your back in the other direction. And we're just going to roll back and forth like this. And we're stretching those muscles out. You can reach out and kind of drag yourself forward. Roll with the ball. You'll find as you work with the ball, the more you get used to it, the more you understand the benefits of how the rolling in different directions can really stretch muscles differently.
Yeah, there's a lot of things you can do with it. I use the ball almost every day, and there's just a couple of my favorite exercises, and we'll get to them today yet. Sure.
Now, this, if you're trying to stretch some muscles on the side, you can do this over this way, gets those lats. This is a little more aggressive. You're only going to do these stretches if they feel like a good, healthy stretch and no pain. If you develop pain with it, you're not ready for it yet.
Probably getting a little bit of the quadratus lumborum there with that.
Yeah.
Too
Sure, right.
But like you said, the latissimus dorsi and the quadratus lumborum, good stretch to do.
And you do this and you get that latissimus dorsi, which goes down and connects to the fascia of the low back. So you're, one thing, there's everything's connected to each other in that area. So it's all working together. Okay, now back pain also oftentimes is related to core strength. You want to get some core strength, and I think the ball is one of the best core exercise tools there is. You just have to know how to do it, so we're going to show you.
Are you going to do seated first, Brad, or do you want me to do mine?
I'll do seated first.
All right, go ahead and do seated, Brad.
Now, this is a nice way to get used to the ball if you haven't been on it before. You're just going to sit on it, and if you have a cupboard like here, you can grab onto or have a chair on one side and get used to it and just get used to moving the ball around. But if you're holding on, even on one side makes a tremendous difference on your confidence. But it won't take long, and you'll feel comfortable with your hands on your knees like this.
Try to have good posture. Always want to have good posture when you're doing these things.
So now this can do a lot of motion for your low back, right to left, forward and backwards. It's going to loosen up that lumbar spine.
And you can do a little bit of almost pelvic tilt, can't you, Brad?
You bet.
Anterior and posterior, which is a little bit difficult to understand, but probably beyond the scope of this program. But you can do it if you watch some of our other videos.
Sure. So a good one to start with here, once you feel comfortable in the ball, you'll loosen your back up a little bit. Good posture, like Bob mentioned, is simply lift one knee up and the other. Now, this does a lot more for your core than you think. If you haven't been working your core very much, and I've had people work with this, and the next day they say, I can't believe it, my stomach muscles are sore.
Just from doing this.
Right. Yeah. And so you do repetitions, 10 to 20 of these, depending on your comfort level. And then this one, good posture and kick. And here you're getting hip flexors, quadriceps, and again, core all works together to maintain this posture. And then the next step there is you take your right leg and go up, and your left arm to go up at the same time. So you alternate like this. I'll give you the front view like this. So it's here, like you're waving high and bringing that leg up at the same time, You got to add a little.
You're being friendly and doing your exercises.
There you go, Bob. Say no more. Oh, that's a nice ball.
All right.
Okay, Bob, go ahead.
Going into my round here now. So now we're going to go ahead and do a little bit of core strengthening in the prone position.
Right. So we're going to work the core muscles on the backside, which oftentimes gets neglected.
So this is a simple one to start off with. You're just doing hip extension. So
right here, we're working a tremendous amount of hip and the low back, those multifidi, and the lower.
Same time.
Yep, it's a really nice low back strengthener, and the ball takes a tremendous amount of stress off the back. It's a great way to start working low back.
Great for beginners,
right?
I would say it really works out well for that. So then you're going to go ahead and you're going to do some back extensions here,
right?
And this is good. I saw somebody already made a comment about a herniated disc.
Sure,
and we've got a whole program for that, but you could try that on the ball where you go like this and you're going to work on extensions like this.
Right. You notice Bob is using his hands to help, so it's taking a lot of stress as far as the muscle strain, but he's getting that range of motion.
Yeah, and again, these should all be painless,
right?
Pain-free. And if you're getting pain down the leg, you want to make sure that's not making it worse, and that maybe even it's making it feel better.
Right.
So that this would be a good way to go ahead and test that and see if it's going to work.
Yep.
All right, then we're going to go ahead just to actually the pointer dog here. So now instead of just doing the leg, I'm going to do the leg and the arms. So generally the best way to do this is to do the opposite leg and opposite arm at the same time like this.
There you go.
And you can switch. This one, involves a little coordination. You'll get better and better at this. It's a lot easier to do it with the ball than it is to do without the ball.
Yeah, the ball helps stabilize the back. If you're recovering from back pain, this is a good transition because after you get strong enough, then you can remove the ball and it adds a little more. I do the one just before this, and I've been working the ball for years, and even though it's a beginner exercise, it's a good staple that'll carry on throughout.
By the way, the pheasant's over there, Brad.
That reminds me, I got a pheasant by my house. It's like there was a nice rooster pheasant by the bird feeder.
Okay.
Yeah.
We live out in the wilderness.
Yeah, well, we better get back to work.
All right.
Okay, now we're talking about, this is a little more advanced for the core, but the nice thing about this, if you have back pain, this whole set of 4 can be a really nice way to work core strength without stressing your back, because your back, you're going to do it on a firm or like a carpeted floor. I've got these mats here that works it nice. And I'm going to work my stomach muscles. My low back is completely supported by the floor. It maintains a neutral position. And I'm just going to try and grab the ball with your legs. That takes a little bit of practice. If you're a beginner, it might be a little frustrating. If you have shorts on, so the skin catches the ball, actually helps quite a bit. wear your shoes, and then your shoes, you hook onto it. And if you do this, you'll know exactly what I'm talking about. And you grab that ball and you just lift it up a couple inches.
This is probably a better sized ball for doing this, isn't it?
Yeah.
I mean,
Yeah, if you get a big ball, it's too hard.
And I've done it with a bigger ball, and it is more difficult.
Sure. Yeah. Now, I can even tell by the weight of this ball is a little more than your normal ball. I can tell just by lifting it here. So you're going to start out with 5 to 10. As you get better, I built up to, I do 50 of these, each one of these, but I've been doing them for years. Great core exercise. Spondylolisthesis people, this is great. Next one is crunches. Just let your legs rest up there on these. Hands across here, and we're not going all the way up to touch the knees. We're just bringing the head and the shoulder blades off the table or the floor. And we're going to do the same reps I mentioned. 5 to 10 to start is good. The next one, the double crunch. Now this one is when you feel comfortable with the first two, the legs up and the single crunch. You're going to lift the ball up and the shoulders up at the same time, kind of like a clamshell, opening, closing. And this one's a little more advanced, but it's really nice on the back. Really takes pressure off the back. And then this one to get the oblique muscles of the stomach, the ones that cross. You do the same thing, but you take your left elbow to right knee, right elbow to opposite knee, and it goes like this. So,
Doing a nice job there, Brad.
That's fun. What do we have next, Bob?
Brad, I'm going to go ahead and actually someone just asked this. This is Lorraine Blake. She's been a longtime follower of ours. I remember, Lorraine, you've been following us for years. We really appreciate it. She was asking if you can do this for knee pain.
Sure.
And I'll tell you, I was having my wife do some of these because you want to strengthen the knee as much as you can, and hopefully that'll help decrease some of the knee pain. Now, of course, there's range of motion things you can do too, but the one that I had my wife try is just this one right here, where I had her start doing some hamstring curls.
Well, you could show the range of motion right off the bat. Just roll it towards.
Well, yeah, you're working on knee flexion here.
Yeah, it's a nice way just to do some simple range of motion.
Trying to get a little more knee bend. But, you can start off hamstrings just very simple by pushing down into the ball.
Yeah, so right now he's pushing, he's squishing the ball, and that's getting those hamstrings to activate and really work. Well, when you do this, you get a very clear sense of what's going on.
And the next progression is to actually push down and bring it toward you.
Right. Boy, those hamstrings are just bulging out.
Isn't that amazing?
They can see that, Bob. But no, really, when you do this and you're pushing down, it's amazing how much this isolates those hamstrings.
All right, and then you can go ahead and do one hamstring at a time, still keeping your butt down.
Yep. This is a progression. That's the beauty of the ball.
And then you can go ahead and lift your butt up here and do doubles.
Oh, yeah. Straighten those knees all the way out, Bob. Oh, that makes it harder, doesn't it?
Yeah.
I'm keeping my eye on them.
And then, of course, to get it even harder, you can do one leg. I don't know if I'm going to be able to do that, Brad. Even.
That's for the high-end athletes.
That's for the young people.
Yeah. That's really steps it up a notch.
All right, then I was going to go ahead and do some squats on the wall.
Yeah, ball on the wall.
And I do these all the time, too. I'm going to show you my technique.
Now, Bob, you just started doing the ball a couple years ago?
Yep.
Yeah. And he's pretty old, so he's been doing exercise for a long time.
But even these, Lorraine, you could possibly try these. You could do real shallow squats like this. Make sure that they don't hurt your knee.
Yeah.
A lot of times
you have something to hold on to.
Yeah. A lot of times you do these real shallow ones. You're not going way deep down like this because that could probably hurt your knee. But if you can do the shallow ones and don't bring your knees in like this, keep them out over the toes.
So yeah, don't let them come in. Yeah, they need to be in good alignment this way.
So why don't you take this, Brad?
Sure.
And then for the people who aren't having knee pain, what I like to do is, again, I keep my knees out and maybe even turn down a little bit. And I like to do a kind of like this, Brad. I bring my arms together like this.
Sure.
And then I go like this so I get posture
right.
and the knee strengthening, leg strengthening at the same time. This is just a great one to do. And you breathe in.
This is one thing that we always try to emphasize on all of our exercises. Get that posture, get your breathing going, the basics of good health of your body.
Yeah, I love this one. I do this one every day, Brad, and I'll do like set up 30.
Really?
So, yeah.
You keep that ball in your living room?
No, it's up in my bedroom.
Where else you do your exercise?
That's right.
Yeah.
Why not?
Exactly.
Okay, where are we at now? You're doing prone
push-ups,
Brad.
Yeah. Now, when you get a little more comfortable with the ball, we can also work on some arm strength and core at the same time. And what we're going to do is go prone or stomach first on the ball, like this. Oh my goodness, someone's happy over there. And now the beauty of the ball here
Somebody
is,
sees Brad's face.
if we're doing push-ups, we should get that little baby in here and show him to the world. Go like this. That's very easy. Now when the arms get stronger, you simply walk out, and then it gets harder. And the farther you go, am I still on the screen?
Yeah, you're still on the screen. I don't know if you're on Facebook yet.
And for you real strong people, athletic type of people, you can go way out to your toes. I'm running out of room. And then you do the push-ups out there, and that's very difficult, very challenging. The other thing, if you're recovering from rotator cuff and you don't want to do the push-ups, but you want to get some weight bearing through the joint, this is something that therapists will work with. And that's just simple elbows locked and walk out. Simply a shoulder joint exercise for stability of the shoulder joint. You know, elbows locked, you can also do this and work that subscapularis. I always kind of like that one, Bob.
Which one?
This one. Yeah.
That's right. He's bringing his shoulder blades together there, and yep, that's a difficult muscle to work.
It is.
It's actually one of the good ways to do that.
Yeah.
So.
Wow, and it's a really good workout. It's just a nice thing, and kids like to play them too. If you're not working out on them, you can kick it outside and let your kids chase it around the yard. Especially this one, you don't have to worry about this one getting popped by, one of the sharp toys in the yard or whatever you might have.
Someone was asking about kneeling squats. Do you know what that is?
Kneeling
squats.
squats.
I have no idea what that is.
That's a good cry. I'm trying to think what that might be.
I think we might have just got disconnected again on our comments. Otherwise, if not, make sure you guys are giving us questions now.
Maybe they got sick of looking at
it. You got anything on Facebook?
Can we do these exercises with this balls?
So the question is, can we do these exercises with a bulging disc? You're going to want to be careful with a herniated disc. Somebody had asked that too, that you're not supposed to do the twisting.
Right.
Right. And you're absolutely right. These are more to try to keep your maybe run-of-the-mill back pain. You could try the extensions.
Right. You could do these at different levels. If it creates any worse pain, particularly down the leg or in the back, you're not going to do it. It should feel good. The exercises where I'm laying on the floor like this may be, depending on the level of your pain, but one way or another, you follow the rule. If it makes anything worse at all, then you do not do it. Okay? These are not exercises that are going to create pain and get you better. That's not the idea. So you'd have to, I would go to a therapist if you have a bulging disc and work with them with the balls.
Or herniated disc, either
Right.
one. I would say go ahead with that.
It's a very good question.
Lonnie, anything else on your side?
Exercises for hip bursitis.
Exercises for hip bursitis. One thing with hip bursitis that I would recommend, Brad, which we kind of did with the knee pain recently.
Sure.
I would try to take some stress off the bursa by using a gait aid for a while.
Mm-hmm.
And people, they really hedge against that.
In other words, a cane.
In other words, a cane or something, or a crutch, or a walking stick, if that, and if you can't, just do it in public, do it at least at home. But that's going to make a big difference, because generally a lot of times people with bursitis, they're doing this type of thing. They're doing a little bit of sachet because there's tenderness there.
Right, and that muscle is what keeps you stable and upright, and you get that, we call it Trendelenburg gait, where you start walking sideways like that.
So, the number one recommendation I would make is go get a gait aid, maybe a cane, maybe a stick on the opposite side. So if I'm having pain on this side, I'm going to go ahead and have that, and it's going to be there when I take a step, and that's going to take a lot of stress off that bursa.
Right. We do have some videos that strictly address hip bursitis, and we can show you some other treatments that are effective.
Yeah, eventually you'll want to try to do some strengthening and stuff like that, but and we sometimes try a massage around that area.
Right.
But
if it's tender, a cold pack, go back to the basics.
Cold pack and maybe an anti-inflammatory. Sure. To try to calm it down. So
our comments over there got held up by something.
No, I think we're getting some of them now.
Oh, good.
Are those walking shoulder exercises okay to do with C-spine narrowing and stenosis?
So the question is, are those walking exercises the one where you walked out on the ball, Brad? And is it okay to do with C-spine narrowing or spinal stenosis? I would say no. That would probably irritate it. Wouldn't you say?
Right. It depends on.
You want to show what they were talking about?
Yeah, the severity of the stenosis. But if you did these, I'm assuming this is what they were talking about.
Yeah, I'm assuming it's going to make it feel worse.
Right, because you are putting a fair amount of stress on the neck and the muscles around it. So, yeah, I would probably stay away from those and be safe.
Yeah, with the stenosis, you don't want to keep range of motion in your neck, but you don't want to be putting too much stress on it.
Right,
So,
right.
so,
Exercises for tightness in lats, which is leading to pain in hips.
so she's having a lady says she's having, tightness in her lats, and it's leading to pain in their hips.
Well, you could do a nice stretch with the ball for your lats like this, and that takes pressure. There's no pressure on my hips to speak of right now, and I'm getting a nice stretch to those lats, which goes down into that thoracic.
Yeah, I don't know if the lats are causing your hip pain, though. Do you think, Brad?
Well, that's what I was kind of wondering too.
Why don't you sew like a IT band stretch? That's a good stretch for the hip.
You mean on the wall?
You could do it on the wall, or you could do it laying down. But yeah, why don't you do that?
So the IT band is right where the white strips are on my pants, from the knee to here. Okay, now I'm going to do this leg. I'm just going to lean into the wall this way to get that stretch, and that's a nice way to stretch that IT band. A lot of this is kind of hard to do very quickly like this over the internet. So just take this with the best we can do for you.
Yeah.
These specific questions.
Someone was asking if you do shoulder exercises with the ball. If you go back when we're done, go back to the start, because we were showing some shoulder exercises with the ball that actually work out really quite well.
Right.
So
they're really good for stretching and range of motion. And then at the end, we did the press ups and the push ups.
Yeah. So we got that kind of covered already.
Right.
So how to deal with forward head posture and any exercises, I think, for pecs and strengthening for rhomboids.
So someone's got trouble with forward head posture, and they're wondering what you can do for that. And plus, they got some. Well, we're talking about the pecs and the rhomboids,
Right.
But with forward head, I mean, you got a chair here, Brett, or you want to sit on the ball maybe and do some chin tucks?
No, we could, if you're doing it with the ball, we could, once you get comfortable with it. Where's that ball, Bob?
You could do a good stretch like this, if you want to do it with the ball.
And then a towel here, so you got some support. You can throw some chin tucks in. And gravity's working with you. It actually works quite well. But you do have to get comfortable on the ball first, or you won't be relaxed.
Well, you could even bring your head down a little more and just stretch everything there, couldn't you?
Yeah.
And that's stretching everything out there.
But the towel really is helpful if you're working with your neck, just for some support.
Remember, on forward head, you got a lot of things going on. 1, the neck is forward. 2, the back is often rounded. 3, the shoulders are often internally rotated and tight. So we got to work on all 3. You want to do chin tucks, you want to stretch the chest, and you want to strengthen the muscles in the back here.
Right, those rhomboids that you had mentioned. So there's a lot going into that answer.
Show the best way to strengthen those rhomboids, Brad.
Right.
I mean, if you haven't already, we got the wall anchor here. We've always got this listed below in our Amazon products. It hooks up to, you go ahead and screw it into a stud on the wall, and then you can take bands and you can do literally thousands of exercises, and you can really work well on your posture when you're doing it.
Silence. We have silence.
Yeah, we have silence.
Silence is golden.
Anything more on you, Lonnie?
Oh, somebody's saying about the kneeling squats.
Someone's talking about the kneeling squats.
She's saying that maybe sitting on a ball, squeezing inner thighs and releasing. That may
Someone's saying that a kneeling squat might be
the clan. This, or
I'm not sure.
Well,
it's the mystery of the kneeling squats. So
I have a feeling it's something if we saw it, we'd say, oh, we'll be called something else. But one way or another,
someone wants to talk about exercise for rehab for a broken clavicle. You actually did a whole video on that, didn't you? That for your your friend? Didn't he have a broken clavicle?
Yeah,
He did a-
exactly right. And we have that video out.
Yeah, one of the things with a broken clavicle after you're recovering is you want to make sure that everything's getting stretched out. You're stretching the pecs out
Right.
because that's really easy for things to get tightened up. So you want to make sure you stretch the pecs, and there's a lot of ways to do that.
Right.
One, you can go into a doorway. Okay, let's pretend this is a doorway. I'm going to put my arms on both sides, and I'm going to lean in, and that's going to go ahead and stretch the chest.
Ooh. And this is, you have to do this later on when it's too tender.
Right.
Or this is when you're 3/4 of the way through the rehab and you're starting to use it more. That's when you want to get that stretched out in a gentle.
Yeah, there's not a lot of things you can do for the clavicle, really. You got to let it heal, and then after that, then you want to strengthen the muscles in the front and the back.
Right. Get the range of motion.
Yeah, always strengthen your postural muscles. So we can take one more, otherwise we're going to wrap it up here.
What do you say? Lonnie's empty there.
I'm empty too. Let's bring it off.
There you go.
Thanks everybody for watching. Join us next week for another live show.